So today we're going to learn about the effective treatment for depression, fatigue, long-haul COVID, and so much more, all the physical challenges. The ketamine vitamin therapy. Lisa Scheller is the owner of the center. Welcome to Lifestyle.
Thank you.
Good to see you.
Good to see you.
So let's talk about what it is and who are the candidates for the work you do.
Sure. So ketamine therapy treats depression, PTSD, OCD, anxiety. It's actually an anesthetic drug, but given in low-dose infusions can treat mental health conditions.
So how did anybody discover that? I mean, it's interesting because that happens with medicine. Sometimes I go, oh, by also way, the side effect is?
Yeah, so in the 60s they were giving it to soldiers who were bleeding out in the field because it's an anesthesia drug that also offers pain control. And later, some of them were reporting elevated moods and feeling better, and eventually somebody found the common denominator was the ketamine, and so they started studying it for mental health back in the 60s.
That is really interesting. So now it's sort of emerged into this opportunity for almost anyone who has these issues?
With treatment-resistant depression. So it's really meant to pick up where other treatments have failed. So if they've tried other things, medication, psychotherapy, and just hasn't worked for them, then ketamine might be the next option for them.
And so what's the process?
We give them 6 infusions in about a 3-week period of time, and then a single booster infusion as needed for symptom return, maybe every few weeks or even every few months.
Do they have to have a doctor's recommendation prescription for this?
I do the prescribing, but we do have their mental health provider just document that they've been properly diagnosed and treated in the past.
Well, because that would make a big deal. Well, because we're hearing so much about COVID and long-haul COVID, what are the complaints that people have if they have that, and how are you seeing the treatment work for them?
Yeah, we see a lot of long-haul COVID. In fact, Anthem has been reimbursing some of our clients for post-COVID conditions, mainly fatigue. We see a lot of. Some people have some nervous system disorders. Some people have, heart cardiomyopathies and things. And so really where people come to see us is for fatigue mostly.
So when you say you have several sessions with that, how long does it take typically?
For the ketamine
session?
or for the, so the COVID is with vitamin therapy, and they come usually once a month or once every few months. With ketamine therapy, it's a 45-minute infusion, and they come that 6 times in that 3-week period, and then once every few weeks or months for a maintenance dose.
So is there an educational piece to this that before people start, they can come and have a conversation about if this works for them? Yeah,
we do a pretty lengthy consultation to first deem if they're a candidate, but also to explain to them how they'll feel while they're infusing, because ketamine is structurally similar to psychedelics, so things get kind of weird in there. So we want to prepare them for what they might see and feel.
And how long does that last typically?
The results?
The psychedelic?
Yeah. Well, the psychedelic aspect really just lasts while the infusion is going. So once the pump stops, all that stuff fades pretty quickly.
Okay.
And then the lasting results much longer.
I was going to say, so much longer. Now, is this something you find they have to repeat maybe after a year or so? Or?
Yeah, they get maintenance doses, every few months, per year. But ketamine does make physical changes in the brain, in mood, emotion, and memory. So those last much longer than the medication in their system.
Well, this got to be really satisfying for you.
Oh, it's very rewarding. We see life-changing results in many of our people.
Best way to reach out to you?
They can send their information through our website, evansvilleketamine.com, or they can email us at info@evansvilleketamine.com.
And they should probably talk to their psychiatrist, psychologist?
They can, or they can contact us directly, and then we can be in touch with their provider.
So, total service there. Thank you, Lisa.
Yes, my pleasure.
Appreciate
Thank you.
Having you on the show.
Thank you.